pulmonary drugs for smoking cessation. This is Dr. Phyllis Dumont. The relative effectiveness of methods used to treat tobacco dependence. The most effective non-pharmacological method is group counseling. The most effective of the pharmacological methods is varenicline or Chantix, which is almost twice as effective as some other methods. But there's also high efficacy noted for the use of the nicotine replacement treatment for, especially for the inhaler and lozenge and nasal spray. It should be noted that the nasal spray has very low patient acceptability, however, because it causes sneezing and a great deal of irritation. Nicotine replacement therapy path dosing, duration, and instructions for use. Dosing is determined by the number of cigarettes smoked daily when the patch is started. If the person smokes more than 10 cigarettes per day and weighs more than 45 kilograms, you start with 21 milligrams per day with the nicotine replacement patch for 6 weeks, followed by 14 milligrams per day for 2 weeks, and you finish with 7 milligrams per day for the additional 2 weeks. Patient smokes less than 10 cigarettes per day or their weight is less than 45 kilograms, then you would start with the 14 milligram per day nicotine replacement patch for 6 weeks, followed by 7 milligrams a day for 2 weeks. The patches need to be applied each morning to non-hairy skin sites, and the patient should be taught to rotate the sites each day to avoid skin irritation, which is the most common side effect. The patient will be encouraged to stick with it and try over-the-counter hydrocortisone cream if minimal skin irritation occurs. Of course, if they get a terribly itchy and violent reaction to it, hydrocortisone cream is not going to help. The patch should be removed and replaced with a new patch each day at bedtime. Leaving the patch on overnight, however, may cause insomnia and vivid dreams. If so, take the patch off at night and replace the patch the next morning. For the first 3 hours after replacing the patch in the morning, cravings may occur. If so, you can advise the patient to use a short-acting nicotine replacement therapy such as gum or lozenge while waiting for the plasma nicotine levels to rise from the new patch. Speaking, nicotine replacement therapy is used until the patient feels that he or she has stabilized as a non-smoker. The patch may be used indefinitely if needed because nicotine replacement therapy use is safer than continued smoking. Nicotine replacement therapy is often used for a longer period in patients with comorbid psychiatric conditions or patients with other substance abuse disorders. Nicotine gum is an example of a short-acting nicotine replacement treatment. Nicotine is absorbed through the oral mucosa, which avoids the first pass effect, and peaks 20 minutes after starting to chew. Several flavors are available, so if patients don't like one, they do have some other choices. Dosing, duration, and instructions for use. The dosing is based on the number of cigarettes smoked daily. If the patient smokes more than 25 cigarettes per day, they start with a 4 milligram dose of gum. If they smoke less than 25 cigarettes per day, they start with a 2 milligram dose of gum. The patient should be advised to chew at least one piece of gum every 1 to 2 hours while awake, and also whenever there is an urge to smoke. The patient can use up to 24 pieces of gum per day for 6 weeks. The technique of chewing it is very important for success, and we talk about the chew and park technique. The patient should chew the gum until the nicotine taste appears, and then park the gum in the cheek until the taste disappears, and then chew a few more times to release more nicotine. This pattern imitates the pattern of puffing on a cigarette, and it helps the patient to titrate to their level of nicotine that they need. The gum is chewed in this way, chewed and parked for 30 minutes, and then the gum is discarded because all the nicotine in the gum will be released after 30 minutes of this pattern. Coffee or carbonated beverages should be avoided because they inactivate the nicotine in this formulation. Side effects are mostly related to excess nicotine release from overly vigorous chewing. Commonly, the side effects include nausea, vomiting, abdominal pain, constipation, hiccups, headache, and excess salivation. Also, patients may experience a sore jaw and mouth irritation or ulcers or interference with various dental appliances or bridges and that kind of thing. The nicotine lozenge is another short-acting nicotine replacement treatment product. The pharmacokinetics are similar to that of nicotine gum. It comes in different flavors. It's easier than gum to master the technique. And a mini lozenge is also available. The mini lozenge provides fast dissolving and faster delivery. Dosing and instructions for use: placed in the mouth and allowed to dissolve for 30 minutes. The dosing is based on the time to the first morning cigarette. Smokers who smoke within 30 minutes of awakening, it's recommended they start with 4 milligram dose. Smokers who wait 30 minutes or more after awakening to smoke can start with a 2 milligram dose. Use up to 1 lozenge, Q 1 to 2 hours for 6 weeks. Use no more than 5 every 6 hours or 20 per day. And then patients are advised to gradually reduce the number of lozenges used per day over a second 6-week period. The advantage of the lozenge over the gum is it can be used in smokers with TMJ, with poor dentition, with dental devices or dentures. Side effects include mouth irritation or ulcers, in addition to nicotine-related side effects of abdominal pain, nausea and vomiting, diarrhea, headache, and palpitations, all of which are dose-related.